Assalamu alaikum my dear students. Once again welcome to my YouTube channel by the name MS Lectures, and today I will be demonstrating you about the very important lung disease, which is the emphysema. So first of all, talking about its pathophysiology. So in emphysema what happens that the destruction of the lung tissue occurs. So lung tissue destruction occurs. Now why lung tissue destruction occurs? Because of the infection caused by the bacteria and viruses So due to these infection, what happens that the function of cilia is disabled. Function of cilia is disabled. So we know that the function of cilia is to propel the infectious particles out of the respiratory tract. So if the cilia is not working properly, so those infectious particles would remain inside the respiratory tract and it would cause invasion, ultimately causing the lung tissue destruction. So that's why the function of cilia is very much important. So that movement of cilia, that propelling out of infectious particle from the respiratory tract, so that function of cilia is disabled due to this infection. Thirdly, what happens that due to the more mucus secretion, what happens that thick mucus plaques are formed. Thick mucus plaques are formed due to the more mucus secretion. So due to the formation of the thick mucus plaques, it leads to the condition known as the inflammatory edema, because we know that due to the accumulation of mucus inside those pathways, the lumen becomes narrowed, so it causes obstruction. That's why it causes the condition known as the inflammatory edema. So now talking about the effects of the emphysema, that what does emphysema does to our respiratory system. So first of all, what happens that it causes the bronchoconstriction. We know that what happens that inside the bronchi, mucus is accumulated. So due to that accumulation, bronchi get constricted. So due to this constriction, what happens that expiration becomes very difficult. So it is very much difficult for the patients to expire out the carbon dioxide due to that narrowed lumen. So expiration becomes difficult during the emphysema, as the pathway is shortened, lumen is narrowed because of the accumulation of mucus, and it causes the bronchoconstriction. Secondly, decreased diffused capacity. Diffused capacity is decreased. Now I would explain you that how diffused capacity is decreased by the help of diagram. We know that the walls of the alveoli are folded like this in order to increase surface area, but in the case of emphysema they become like this. So the foldness of the walls of the alveoli is decreased. That's why it leads to the decreased diffuse capacity. So the exchange of gases, oxygen and carbon dioxide, does not occur normally, which leads to the decreased diffuse capacity, and ultimately to the condition known as the hypoxia. So this is the outcome of this second outcome of emphysema or effect. Number 3, it is the V by Q ratio becomes abnormal. V by Q ratio becomes abnormal. We know that the walls of the alveoli in the emphysema, during the emphysema, gets damaged. So due to that damaging effect, what happens that the ventilation perfusion is affected. Then number 4, it is the pulmonary hypertension occurs. So pulmonary hypertension occurs because the pulmonary capillaries, we know that in the pulmonary capillaries, what happens, obstruction occurs, accumulation of the mucus occurs. So due to the accumulation of mucus in the pulmonary capillaries, pulmonary hypertension occurs, which actually affects the right portion of the heart. So in this video I have explained you all the effects and the pathophysiology of the emphysema. Hope you have understood it well. Last but not the least, don't forget subscribing MS Lectures. Thank you.